A baby will respond to its mother actually from the social smile that they develop at six weeks old, and then they progress to smiling and laughing with whoever they are looking at, and subsequently they start to babble, and by first year usually they start to speak some words, usually addressing the mom or the father that they see every day in their lives. So usually the word mama, dada will be spoken at the first year of age, and usually the vocabulary will start to build up from then. Single words up to 20 words, 50 words, and usually after 60 words vocabulary, then only they can speak in sentences. So those who are delayed in speech will be those who by 2 years are not able to speak in sentences at all. So usually parents notice them that they are not able, they might understand spoken words, but they are not able to actually repeat the words or respond to them when they are talking. There are some signs to watch out for. So by 12 months, if the child lack gestures, or even unable to point, or even unable to wave, and you need to be careful, to be alert about this. And of course, there's no first words at 1 year. Then we need to actually also take note of that. And usually they start to imitate sounds by 18 months. So lack of imitating sounds also can be a cause to be a concern. And usually by 2 years, that's the latest age whereby when the child can only name a few things, or unable to even join certain sentences like, I want to eat, and they are talking in phrases rather than sentences that they can make up themselves. Then you need to actually see a psychologist or a developmental pediatrician, or even a speech therapist for help. There are many causes of speech delay. First, sometimes any problem with the oral motor movements. They can have problems to articulate the words well, so they are unable to actually say the certain words very well. And many kids also have hearing problems. Hearing problems doesn't mean that the child is born deaf. They might develop problems during recurrent chest infection, throat infection, so there might be glue ear, so that will actually impede their hearing, and thus causing delay in speech. Ear infection is actually very common, so it does affect hearing, and but it is so easy to actually treat, and it will be a detrimental thing if the child is left on its own without seeking for help, if this is if we haven't sorted out hearing problems for this child. As I said earlier, that this hearing problems are one of the most important causes of delayed speech. It is the most treatable one as well. So usually when the parents seek help, we need to ascertain whether the child hearing problems is actually, whether the child has hearing problems or not. And subsequently, if the child's hearing is normal and the behavior is normal, usually there's no problem for the child to develop speech itself. So assessment by a psychologist or a speech therapist is also good to help diagnose or pick up some other problems that may contribute to the speech delay. For example, other behavioral problems like autism or even speech language delay in childhood itself. However, most commonly children who are understimulated, especially when they are from isolated families, and when they are a lot of playing with gadgets, phones, and watching TV, sometimes can impede their social interaction, and thus the child will be understimulated and will not be able to speak at the age that they are supposed to do that. So what can parents do? Basically, spending a lot of time with your child, communicating without the presence of TV and other gadgets is actually very important. And reading to your children is actually very good to stimulate language, to stimulate not only words, to introduce not only words, but also to introduce languages to the child. And we use everyday situation to get the child to be interactive with us, like going to the park, like going to the supermarket, going to school, going to the grandma's house, or while you're cleaning or while you're cooking. So some of those scenarios actually help a child to interact with you, and you can actually introduce words to them during those day-to-day scene. So recognizing and speech delay is very important for the child to be able to speak well and on time for him to go to school.